The first thing to do is assess the shape of the patient's limb. Is there an inverted cone shape? Secondly, assess the patient for bony prominences. This includes the tibial crest, malleoli and dorsum of the foot. The foot needs to be positioned at a 90-degree angle, often referred to as toes to nose. The first layer that needs to be applied is K-Soft. This is designed to absorb exudate, but its most important function is to reshape the leg and protect bony prominences as required. Firstly, take the edge of the bandage and align it with the edge of the toes. Take it around the base of the foot, and that is the first turn secured. If the foot is longer, a second turn may be needed. From here, lift the foot to do an ankle lock, cup the base of the heel, take the bandage up and over the top of the foot, under the foot to close the window where skin can still be seen. From here, apply the bandage lightly with no stretch at a 50% overlap. The 50% overlap is to ensure that 2 layers of K-Soft are gained. When moving up towards the knee, be mindful that you finish just below the knee at the front, and at the rear of the leg you should finish 2 fingers below the popliteal space to prevent damage to the tendons. Remove the excess bandage, and that is the K-Soft layer complete. If there is an issue with the tibial crest, a strip of K-Soft can be used down the front of the limb to protect this area. If there is an issue with a bony malleoli or tendons, then an extra turn can be applied around the ankle. If there is an issue with a bony dorsum, a pillow of K-Soft can be created to sit on top of this area. The second layer is K-Lite. K-Lite is a light conforming bandage with no compression. It's applied with enough stretch so that it lightly conforms to the limb. Again, follow the base of the toes with a bandage, however it needs to be applied so that a cuff of fluff is visible between the skin and the edge of the bandage. Take it around the foot and start the ankle lock here. Over the top of the foot, close the window underneath, and then lightly rolling the bandage with enough tension so that it grits the limb. This should be applied at a 50% overlap to ensure that 2 layers of K-Lite are gained. When the top of the limb is reached, slacken off the bandage and a cuff of fluff should be left between the top of the bandage and the patient's skin. At this point, cut off excess bandage as extra K-Lite layers would give added pressure.